I'm Shani Butler and welcome to Let's Talk Therapies, a podcast where we get to know more about the information that is out there and can be delivered to our doorsteps with professional insights and information. We'll find out how therapies can change in a good way or a bad way in our lives for our children. We've got a beautiful guest today, our first stranger on our podcast. Yay! Yay. Okay, so introduce yourself. Tell the world about yourself. Tell us your name.
Okay, I am Tali Frankel, and I graduated from Wits University. I did all my training at Wits, and I graduated in 1998. That's when I got my undergrad, and I've been practicing ever since.
I was 8 years old.
I was older. I love my job. I've always loved the profession. I think that it's an amazing profession with a very, very broad scope. Obviously today we're going to be focusing on pediatrics and children and children's development.
So there is an aspect to adults.
Oh yeah, absolutely. There's a huge aspect. We work with people who have been in car accidents or who've had strokes or who have degenerative disorders like multiple sclerosis.
Sclerosis affects speech.
So what happens is that in disorders where there is a muscular degeneration, often what happens is that the muscles of the mouth deteriorate, they lose strength, coordination.
That's very interesting.
And that can impact not just the quality of speech, but also swallowing.
Oh, wow.
And so we work a lot with swallowing, we work a lot with speech clarity and intelligibility. And in things like head injuries in the case of a car accident or with strokes even, we also do a lot of executive functioning work. So things that would be affected are things like concentration and memory, and that can have a massive impact on communication and how people are able to have conversations with the people who are important. I didn't
realize that. Honestly, assumptions, because I work in childcare. Yeah. So the only therapy that we get recommended is OT, speech therapy, physio, and I legit thought that it was only for children. So that's very interesting. I've learned something new today. That's very interesting.
And because I loved my degree so much, I went back and did postgrad work and did some more postgrad work.
You're one of the crazies that love studying.
One of the crazies who love studying and never stops.
So what would have been you're a speech therapist, what would have been the degree that you went to go apply for?
So in Joburg, you can only do speech therapy at Wits.
Okay.
And it is one of the only degrees in South Africa which is, it's the only speech therapy degree in South Africa where you do a BA.
Okay.
In other departments across the country, if you're in Cape Town, if you're in PE, if you're in Durbs, you would be doing a BSc. So you would do a science degree. I think
that's a big difference for also for a young child or a young person who's studying to go into the world, into the working world. If you've got a BA compared to a BSc, is that quite a difference?
So not really. I think that we were part of the BA faculty more for political reasons than anything else. I think the head of our department had a lot of colleagues who were allies within the arts faculty.
Okay.
But because we deal so much with communication and the emotional impact that communication has, it does fit quite well alongside things like psychology and languages, which are all within the BA faculty. But even though we did a BA, we did do 4 years of anatomy, we did do dissections, so we did spend time at med school.
Dr. Frankel.
But I can't write your prescription. And obviously there's the clinical component. So as you're learning the theory, you also then have to put that into practice. Okay. So as a student therapist, you're constantly being monitored by your tutors. So you are observed giving therapy. You have to put in therapy plans. You've got to evaluate how well your therapy went. You've got to write therapy reports. So there's always that clinical component. Now what's happened is because the degree is so big, it's split. So when I did it, I qualified as both a speech therapist and as an audiologist. It was a dual degree. That doesn't happen anymore. Now you do a first year kind of general introduction and then you pick. So you either become a speech therapist or you become an audiologist.
Which I feel like your way is a lot better because then you can pick up a lot more things. If you understand the ear and having to connect those two, speech and ear, so you've got the upper hand really having...
Look, I think that the first year gives you that kind of foundational grounding so that you understand the relationship. But the truth is that audiology is a very, very sophisticated degree. the technology is so advanced now that the amount that you need to know, the as I said, the level of sophistication of the material is massive, and you can't do both. And the truth is that even though I graduated as an audiologist, I've never practiced as one.
So you wouldn't say I'm an audiologist?
I don't consider myself an audio. I mean, I've never fitted a hearing aid. I've never done any.
But you know the inner working, so that's.
So I understand the anatomy of the ear. I understand how the ear works. I understand what that means in terms of like what we call central auditory processing disorders. So some of our little ones who are going into formal schooling and have difficulty with following instructions, listening in noise. They have red flags for reading difficulties. Having an understanding of how the ear works and processes sound is obviously
going to help.
Helpful. Yeah.
We'll touch a little bit on that as we go.
Yeah.
But we're still on the introduction. So, as your suggestion, you'd say for any young person out there who'd want to be a speech therapist is to go out, do the first little course, and then pick from there where they'd like to go.
So you register for the degree.
Okay.
And then once you're in the degree, so first year is a general year, and then the other 3 years.
What do you need to get into university? Just a normal matric certificate?
So you would need to get quite a good matric.
Okay.
You need to do quite well in maths and in your first language, your home language. And then you would need to do a science, actually.
Okay.
So when we did it, I mean, you've got to check the requirements with each department, but certainly when I did it, we had to do either biology or science.
Okay.
Because there's so much anatomy, you do need one of the sciences.
For sure.
And they're quite picky. It's a very limited course. So in other words, I think there are probably only around 40 or 50 people that they accept per year.
It's a little bit, eh?
It's very little. I mean, when you think about courses like psychology where you've got 1,000 people, or like accounts, first year accounts, which have got 1,000 people.
100%.
I'm talking about Fitz numbers. That's what I'm familiar with. But yeah, so if you were going to apply anywhere else, you would need to get into a science faculty. You would need to do a science for sure, and you also need to do those. I never had to do them. Those NBTs, the National Benchmark Assessments, which also look at like your language and your mathematical proficiency. So you'd need to do quite well.
So you do need to have some sort of basis of like marks, good studious person would then do it. No one is looking for a quick.
No, it's quite an intense degree.
Yes.
You need to be committed.
We do know a few audiologists, like in my generation of just leaving school, a lot of our friends became audiologists. And that's quite interesting to me, but that more than one person became an audiologist, which is quite interesting, don't you think? If in your group circle, to have more than one person do the same thing.
It's a great degree.
It is a great degree. Let's talk about information that you can give our parents to understand. If your teacher or someone suggests to you that your child needs a speech therapist, what does that mean? How can we take it in a positive way and not in a negative way? Because I often find as soon as someone suggests that your child needs a therapy, we as parents, we take it on as a personal attack, because we've always put all our efforts and our hard work into our kids. So when we see them not thriving at 100%, it's very easy to look inward as a parent and say, is it me? And we want to debunk that by telling you it's not you. We're just trying to help our little guys, that's all it is.
So it's a great question. And I also often get parents saying to me, kids are so over-therapized today, and every child's in every therapy. So there are a couple of things to say about that. The first thing is that in the world that we live in today, therapists and teachers tend to work very closely together. And it's because we know that teamwork is the best work.
Of course. And also consistency. You don't want to have you doing one thing, you doing another thing, and we're all doing 3 different things, and it confuses the child. So if we're all on the same page, consistency is key as well.
Absolutely. And so because teachers and therapists work so closely together, we've been able to learn from one another. And so teachers are often interested in what are the warning signs that a child's communication isn't developing at the rate or the quality with which we would expect it to for this particular age group.
Okay, cool.
And so therapists and teachers will often talk a little bit about I'm noticing this and this in a child. Is this a problem? Do I need to refer, or can we just wait? And a teacher would never make a referral, or hardly ever make a referral, I should say, without having good reason.
Yes.
And it always comes from wanting the best for the child,
100%.
as you said. And it's true that when a teacher says to you, things aren't going as well as we'd like, it is very confrontational.
So, yeah, it is.
It is very confronting.
It's because we put all this effort into
Yes.
raising our kids, so that when someone says it to you, it's almost like, that's my responsibility. Oops,
Yes.
I did that.
Yes, but also even, and it's not necessarily about a blame thing, it's about we see our children as being perfect.
Oh,
in
yeah,
a way.
our perfect
And
little angels.
even when in our heads we know that they're not, we feel that they are.
Exactly.
And so when somebody says actually they're not, that doesn't feel great.
It doesn't. It really doesn't.
So the one thing is teamwork is good work.
Yes.
So teachers generally refer with good reason, either because they've checked or because they've had
Someone in the past come through.
Or we've had training together, so they know what to look out for
Okay.
specific ages. And the other thing is that our profession has progressed quite a lot, and so we know that there are certain red flags that don't necessarily resolve over time. And we don't always have good predictors about what's going to resolve spontaneously and
Okay.
what's going to need intervention.
Interesting.
And so
What would you say would be the top 3 red flags?
so it depends on the age group.
Okay, very nice.
So we have different expectations of children at different ages depending on how and where they are developing. So to give you an example, if your 3-year-old is saying wabbit instead of rabbit, that's not an issue.
Okay.
If your 7-year-old is saying wabbit instead of rabbit,
Now we've got an issue.
now we have an issue,
Okay.
right? Same thing if my 2-year-old is saying 50 single words, that is not an issue. If my 3-year-old only has 50 single words,
And maybe their sentence is only 2 or 3 words, then
or even like if they've only got single words and they're not
Okay.
putting words together,
Okay.
that
That's
is
a
an
flag.
issue. That is
Okay.
a red flag. If a teacher is teaching in a classroom and they're giving instructions, or they're conversing with a child and the child doesn't really seem to understand, or they can't follow basic instructions, that would be a red
Okay,
flag.
perfect.
And so we have
It seems like, just from what you said, it's easier to see a red flag as the child gets older compared to when the child is younger, or...
not necessarily, because I think that we've got quite good guidelines in terms of what we expect of different ages. So even before a child starts to speak,
You can see
even
things.
babies have to develop pre-linguistic skills. So things like eye contact,
Okay.
or being able to engage in like turn-taking behaviours, or being able to concentrate on the same object as their parent or caregiver is concentrating on.
Interesting.
All of those things are precursors to actually being verbal and using verbal
Very
language.
nice.
Even things like pointing
Yes.
are important predictors.
Non-verbal
It's
communication.
non-verbal communication, and those things develop from very, very early
Yes.
on. Like eye gaze is established very, very early on. Children also babble from very early on.
Yes.
So even from a few weeks old, babies
you're
are
talking to
cooing
them,
and they're
yes.
making oohing and ahhing noises, and as
You're
they get
introducing already speech to their lives.
Yeah.
So interesting. I love that. That's so cool.
So if for example your 10-month-old is not babbling,
Okay.
that's a red flag.
Yes.
Like we want children to
And
not-
also, like, a generalized thing about pointing. I was super excited when my son started pointing, because that was like excitement for me. And I was like, oh my gosh, he's 7 months and he's pointing. And that was my most excited part, because I knew that he was going to start talking to me. He could
Yes.
start asking for things. I didn't have to
Exactly.
hear the sound, the whining sound or a screaming sound.
Exactly.
It was starting to point, and that
Exactly.
was exciting for me.
100%, because that represents communicative intent.
Exactly.
I want that.
Yes.
Or like even things like shaking your head to say
Yes.
no, like I'm disagreeing with that, or I'm refusing
Or
something,
even that's
or like
the
exactly
high.
the greetings and the kisses
Yes.
and the all of those things indicate an intention to communicate, and those are really important skills.
Okay.
And so as children develop through their different stages, we have different expectations of them. And so when children don't meet those milestones, it becomes very apparent. And the other thing that I want to say about referrals for therapy is that because we don't always have very good predictors about what is going to resolve on its own and what is
Yes.
going to need intervention, we prefer to intervene early.
Okay.
And the reason that we want to do that is twofold. Number one, it's because we know that the earlier we intervene, the more efficient the process is.
And effective.
And effective. So those are two separate things. So what we mean by that is efficient means that if I
How
intervene at the
quickly.
right time, then the chances of the therapy being shorter duration
And more
are
successful,
higher,
yes.
and then more effective more successful and more deeply integrated are higher. Whereas if you leave a problem
too long,
then it becomes compounded
and
it
I also
becomes
think
more complicated to address.
As well as that is the child starts to notice as well, because the quicker you catch it, actually the child doesn't realize actually what's going on, because you're catching it so quick. But if you've left something for too long, 2 years, you've got to untrain 2 years of behaviors that don't connect to whatever therapy that you need to do. So I always do agree, the sooner the better.
Right. And I think also it's important to say that any ethical therapist worth their salt would not put a child in therapy if there wasn't like some sort of functional, I don't know, like deficit or delay that needed to be addressed. Okay. If the child was coping and managing within the range of what we would expect for their age, they wouldn't be in therapy.
100%. I do see a little bit of that. You know, I don't want to call out any names, but someone shouldn't be in therapy for a year. Or is that normal?
No, so it depends on what the issue is.
Okay.
So there's some kids who have very minor, typical developmental delays. So for example, like the whiff or ray, for example, or they might say thock instead of sock, or they might say woof instead of whiff. And those kinds of very almost superficial articulation delays shouldn't require a massive amount of time in therapy.
Okay.
But remember that the scope of speech therapy is very, very huge. And so we also treat children who do have like quite significant barriers to their learning.
Mm-hmm.
And when that affects their language and communication, that can impact on their learning at school.
Agreed.
And academically as well. And so therapy can be quite a long-term process supporting a child through their academic journey, because they might need a lot of help in terms of developing their vocabulary, developing their expressive language and learning how to express themselves and say what they feel and think and put that into words, or to be able to understand what's being said to them. A massive part of what speech therapists are doing now is work with literacy, so getting children ready for reading and spelling.
Yes, that's the biggest thing now in my age group. Harvey's 5 turning 6, and everything is about identifying shapes, being able to read, and being able to get all of that through to his little brain.
Yes, and so the things that he would be doing now then
be
would be rhyming.
Yes.
So like recognizing rhyming words, playing with rhyming words, clapping words into syllables, those kinds of things. And then as he gets into grade 0 or grade R, it would be recognizing letters and being able to make associations between a letter and what it looks like and what it sounds like.
Yes. Okay, I got another question for you. What is the youngest age of child or pediatric that you've ever worked with for speech?
Okay, so me personally, I've worked with like 1-year-olds, but there are lots of preemie babies who will be seen from day one by speech therapists. And again, it's because the preemie babies or babies who are born and they're not well often present with feeding difficulties. They haven't developed what we call the suck, swallow, breathe.
Oh, I just remembered that
sequence.
as you were about to say it.
And those kids require very close monitoring and intervention.
Because
right
that suck, swallow, breathe is supposed to be a natural response to being born. So if you don't have it, that could be
you can't feed orally.
Yeah, that's a very hectic thing.
Yeah, so and they can't be discharged from hospital without being able to eat. So a lot of preemies are seen by speech therapists in the NICU. So again, it depends on what the issue is. So babies who are at risk, babies who are ill, babies who are preemies, those kids would probably be seen very early by a feeding specialist, a speech therapist who is a feeding specialist and would work with the parents.
I know this is a strange question, but as you as a speech therapist, would you pick up the preemie baby, or would you just leave the baby there and try, what do you teach them, lying down, or how would you do it?
So it's not, I have to say here that it's not my area of expertise.
Okay.
I don't generally work in we call it dysphagia, that's swallowing disorders, and they're very strict protocols about how to handle babies.
Yes, no, I think so.
So we do know that like skin to skin contact with parent or primary caregiver is absolutely critical. It's number one. But in terms of actually making sure that there aren't like tactile defensiveness or that there aren't sensory complications later on, the speech therapist would do a range of different things. And then depending on that, again, the particular child's profile, they would either be handled a little bit more or a little bit less.
For sure. Again, it's all based on each child's specific issue that they have.
Right.
So it's not really there's no really real answer to say how long it should be or when it should
Or
stop,
when.
or anything like that. It will all
Yeah.
be based on per child.
Right.
I like that. I think that's very important information.
Yeah. So I think if you think about the range that a speech therapist would cover, we would cover things like we've spoken about feeding a little bit.
Yes.
As a child gets older, so as they approach that 1 year mark, I often get parents phoning me and saying, my child's not talking yet. And then we talk a little bit about, are they babbling, the precursors,
yes.
the eye gaze, the turn taking, all of those things.
And then you can doubt their doubts immediately from there and say, no, don't stress yourself.
Right. And the other thing we often do is that if for whatever reason a child's missed a hearing screening or they didn't get a comprehensive hearing test when they were born, that's always my first port of call with little ones who aren't developing speech and language, is to make sure that their ears get tested.
Wonderful.
So we want to make sure that they're hearing, because if they're not hearing, they can't develop communication skills.
How often would you suggest that a parent should get their child's ears screened?
Okay, so definitely at birth.
Okay.
Birth screening is absolutely paramount. Critical, because we pick up, and that's where we pick up quite significant, like when there are severe disabilities with hearing, we pick them up straight away.
But it's wonderful that we do this now, because there was obviously many years ago stories of children who were 4 when they found out they were deaf. So it's quite interesting that the world has gone so far and we don't want these children to suffer till 4.
Right.
So we're testing at birth.
We test at birth. And then I would say that if your child's the kind of kid who is just an ear kid, you get those kids who are prone to ear infections, who need grommets, those kids definitely need to be guided by the ENT and have regular follow-ups.
Okay.
And then once a child enters school, many schools will offer an annual screening.
Yes.
And I would always say to parents, definitely put your
Take it
name
on.
down for that. Do it.
Okay. So annual screening.
Annual screening.
And you'd say to what age would you
So
say?
generally for nursery school, and like once they get into that primary school, that foundation phase of learning, they tend to outgrow a lot of those chronic ear issues.
Yes.
But definitely during nursery school.
Okay, brilliant.
Definitely.
Good information. If your teacher has said to you that you need therapy, do you suggest using the school therapist, or what? Where should a parent go? Do you recommend that we get 2 or 3 evaluations, or do you just select the one that's been referred to you? How do we go on that?
Okay, great question also. So there are advantages and disadvantages to using school therapists and outside therapists. So I'm going to go through the advantages first. If you use a school therapist, the advantage is that the therapist is on the premises where the child is learning. And especially with very young children, it means that you get them in the morning, which is the better part of the day for them, as opposed to trying to treat them in the afternoon when they're a little bit more tired. You also have access to the teachers.
True.
So lots and lots of teamwork,
Which is
happens,
what we want.
which is what we want. The major disadvantage is that the parent is not necessarily as involved in the therapy process, and for me, the involvement of the parent is also paramount.
Because it's that teamwork, and
It's the teamwork.
It's together.
Exactly.
We also want the parent involved as well.
Exactly, and the parent needs to understand what the therapeutic process looks like. What is the therapist actually targeting?
Yes.
What procedures and techniques are being used in the therapy room, and how can those be consolidated and integrated at home?
I believe in that.
And because the parent, as far as I'm concerned, or the caregiver, is like the most important person to carry over and transfer what's being done.
I agree.
And I often say to parents, I might see your child for half an hour a week or for 45 minutes a week, but that's not going to make substantial changes.
You
It's
sound like
being-
Daniel. You literally sound like Daniel. His life is, we are not going to make your children sports superstars by seeing them half an hour once a week. But what we are going to do is going to give them the love and the want to participate in
Right.
sports. And
Exactly.
that's exactly what you just
And
said. I can't
it's
believe that.
It's like being on diet for 45
Yes.
minutes a week.
It's not gonna
If
do anything.
It's not going to help. It's not going to help. So what we need is a partnership.
Taking that home.
We need to be able to say to the parents, this is what I'm doing, this is why I'm doing it, this is what the benefit is in the classroom and in a social context with the child's friends and
Yes.
peers, and this is how you can facilitate the
I
carryover
love
and the
that.
transfer. So if you are going to go with a therapist who is school-based, make sure that you have a good relationship with that therapist. So for
Okay.
example, when I treat kids at school, the parent will get a voice note every single therapy session. I saw your child today, this is what we did, this is what went well, this is what didn't go so well, this is what we're going to do next week, here's something that you can play
But
at home.
that's a stunning answer for our parents out there, because if you're not getting feedback from the therapist, then you can yourself put yourself out there and reach out to your therapist, because it should be done after each session. I wouldn't have even known that, So it's nice information to know.
So that's the way I work.
Yes, maybe not everyone. I've ruined some people's business.
But I do think that it's important that parents are involved.
Yeah, I agree as well.
And that when you're not on the campus, sometimes the parent doesn't even know whether or not their child has been seen.
True.
Or what was done.
And that's how Tigerz gets around that, is that we offer a stamp at the end of each session. And not only that is it a reward for each child after they've finished the activity, but when they go home, they've got a stamp on their arm, and that's an indicator to our parents to say, your child has attended the lesson.
Exactly.
So it is difficult. As a speech therapist, what do you give at the end? A high five.
Okay, so again, different therapists have different ways. So there is a bit of bribery and corruption that sometimes goes on. So we like to use incentives, especially for those kids that are a bit reluctant.
Yes.
So they could be like sticker charts with prizes at the end or something that you work towards. But I do want to also go back to the other question that you asked, and that is that in general, we consider it to be ethical behaviour to refer to at least 3 professionals.
Okay.
So when a teacher says, I think that your child would benefit from a speech therapy assessment, they should say, this person and this person are on the campus, and you can also phone that person and that person who are not.
Okay.
And then it's up to the parent to make a decision about what works best for them. A working parent sometimes finds it very difficult to fit therapy in either before school or after school.
Agreed.
It's not always easy. And therefore, it is convenient to have a service offered at the school. And it can be a very effective and a very good service, as long as it's
just what works for you.
The partnership.
So either way, we're going to be getting therapy, and if you just keep the communication and the teamwork together, doesn't really matter what premises you're doing it on. It's just to make sure that you're getting your feedback and to recreate those things at home with your children. And that's really what it is, actually. But it's very good information for us as parents to know that we don't just go for one evaluation, but also I'm going to put it out there, because I did that. I took my child for a few evaluations. They're not free. So just be aware that if you are going to choose 4 therapists to go and take your child to, you are going to be charged per session rate to have that evaluation done. So don't maybe do it all the time.
I think think about a situation that will work best for you and your family.
Agreed.
Pick a therapist, and then hopefully you have a good experience. But again, we don't always get on with everybody.
Yes.
And sometimes there is like a clash.
People clash, agreed.
It happens to the best of us. And both the therapist and the parent have to be brave enough to say, look, this just isn't working. And it's not personal, but we're going to move on to
100%.
somebody else. And that's fun.
It is fun.
That's it. And in fact, it's important, because the child's not going to progress with somebody that they don't feel safe with or that they don't have a good relationship
100%.
with.
And in our business with Tumbling Tigerz, I have kids that go from 3, and by the time they're 6 and they're moving to grade 1, Tigerz is finished for them. I have to say goodbye to them. That's even the hardest.
Yes.
So it's not even about a personality clashes. I literally have to say goodbye to them because they're leaving. They're going to another school or another grade.
Yes. I always say to parents when I discharge a child, your child's made enough gains. They've made excellent progress. I'm discharging, and they go, no, but he's going to miss you so much. And I'll say, I promise you now, he's going to forget about me, and I'm going to miss him far more.
As he sleeps that night, he's already forgotten. Quite funny, actually. Okay, so now I want to just go back to the parents, what they can do at home, just to help increase speech, or if they found a delay, how they can help. And I've got 3 questions for you.
Okay.
We're going to start with story time, reading books, because it's my fave.
Yes.
My boy loves a good book. So does that help children to talk better?
Yes. Okay, so if there's one thing that I can encourage parents to do, read, and then read more, and then read more. And for so many different reasons. Number 1, we know that exposure to books and to an environment that is literacy rich helps with all forms of communication. It helps with language development, it helps with literacy development. There is lots of research out there to prove that exposure to books at an early age helps children develop across the board.
Wonderful.
And in terms of everything, not just their language, so it develops their vocabulary, and it develops their ability to use their imaginations and to put themselves into other worlds. It develops the ability to have empathy for other people and to be sensitive to what somebody else might be going through. Another amazing thing about books is that it allows children to deal with confronting, challenging, scary things in a way that
their little minds can understand.
Exactly. So you've got beautiful books that are about loss, or about losing pets, or losing grandparents, gaining a sister, or being sick, or so many different topics can be explored through books that make scary big discussions more manageable.
Stunning.
It's also an amazing time for parents or caregivers to bond with their children. Like, one of the worst things for me was when my kids learned how to read by themselves and they didn't need me to read them bedtime stories anymore. And I pushed. I mean, I was reading Harry Potter to my kids.
Oh my gosh, that's so awesome.
Until eventually they're like,
we're done now.
We can do this by ourselves. But it was one of my favourite times of day. And again, there's no judgment here. I'm also a very busy working mom. I know that there isn't always time. I know that sometimes by the time you get to the end of the day, you're exhausted, and you get home and there's still homework, and then there's supper, and then there's so many things on your plate. But try and make time for it. At least once a week or twice a week.
No, it's just part of the routine. Bath, bed, book, just make it part of your
ideally,
life.
Absolutely. Listen, ideally.
But talking on these books, I've always, as a parent myself, I was always concerned I have a lot of books, and I like to do a book swap with my friends as well. But what is the advantages or disadvantages of reading the same book over and over?
Oh no, reading the same books is great.
It's good.
It's great because it allows children to feel a sense of mastery. You can also get them to predict, what's going to happen next. Or you can even do more high order thinking, let's try to think of another ending for this story. What would happen if we thought of another way that this character could behave?
So it's not an obsession for a child to keep picking the same book. Because I was a little bit worried, I'm wondering, why does he always choose the exact same book over and over? But maybe it's a relaxing thing for him, because it could be an anxiety thing. Maybe he knows what's going to be happening at the end of the book, so he feels comfortable and safe with that book.
Yeah, but it's a familiar thing. Yeah. And you can always, if you are worried that there's never the opportunity to read a new book, you can always use the familiar book as the reward.
Okay, so let's try a new one.
We're going to try a new one first, and then you can read the other one after.
Love that. I love that. It's subtle hints of bribery.
Yeah, always. Incentive.
I'm going to say bribery, I'm going to say incentive.
Yes.
That's the new word. That's the code word, the buzzword for the day. Okay, so besides books, what are some fun games that parents can play with their kids at home? But obviously you're saying we have long days. Could be cute ones. I Spy is a good one.
Yes,
I Spy, and it's good in the car.
Yes,
very
great
good
in the car.
Because you have to identify things.
Yes.
And part of reading is identifying, shapes.
Yes.
Okay, I'm just spitballing here. I think I'm doing a good job.
You're doing a great job.
What other games do you think it could be? Oh, hide and seek could be a good one. Not
In
really.
terms
That's
of?
more of a gross. Because I'm just trying to think of, identifying, picking out something that is there.
Right, so that's great for what we call object permanence, the understanding that something exists even if you can't see it.
Cool.
But not necessarily from a language.
Okay.
I mean, it's a basis for language, but it's, So there are lots of things to say about this. The one is that you don't actually have to sit down and play games to develop language.
Okay, very interesting.
Being with your child and communicating with your child is a fantastic way to develop language. So, especially when your children are very little, there's something that we call parallel talk and self-talk. So for example, especially with my baby and my very young child who's not very verbal yet, I do a lot of parallel talk. So look at you sitting so beautifully. Oh, splash, splash, splash. Isn't that fun in the bath? Here comes Ducky.
Yes.
Okay,
are you not tired after the end of the day?
But talk to your kids.
It's what they need.
So it's what they need. And it doesn't have to be, and the beauty of that is that it's built into the routine.
100%. And that sounded fun. Because they're in the water splashing, and it's splish splash, and you're hearing these splish and splash sounds that are so important.
Yes, exactly. So you can do, so the parallel talk is when you comment on what the child is doing, and self-talk is when you comment on what you are doing. Come, let mommy pick you up. It's time to go to bed now. Let's see if we can switch off the light. Let's make the room darker. Ooh, now it's getting quiet. And so you comment on, you become the commentator of your lives.
You just added 30 words to that child's vocabulary because you said darker, quiet, off. You integrated so many things into just that one experience.
Exactly. And what you're doing is that you're allowing the child to link vocabulary and language to something concrete that they're experiencing. So another great way to do that is to do experiential learning together. And that means that if you are making supper, you can say to your kid, I need an onion. Can you please get me an onion? Where's the potato? We're going to cut the potato. And they can sit on the counter, or you mixing a cake together. Let's sift, let's pour, let's stir. Your mommy's helper, whatever. So everyday routines are an abundant source of language. And it's, again, bonding. It's not something like where now I've got to sit down and I've got to play a language enrichment game with my child, right? Okay, so...
At 4:15.
At 4:15, okay. So I think that we underestimate how impactful and how significant giving your child undivided attention is. And I know we live in this very digital world where all of us are attached to our phones 24/7, but the ability to put that aside for half an hour or 20 minutes even, and just give your child that undivided attention.
What I've been seeing on socials the most recently is this concept of, let's not distract our children by putting it in front of the TV. Let's include them in our lives, and that comes back full circle to letting them cook with us, letting them, if we have to unpack a cupboard, let them unpack with us. If we have to repack the car, what are we taking to the car? You carry something. Don't make it all upon the parents. Include your child in those daily responsibilities, because at the end of the day, when they feel responsible for something, they feel independent, they feel confident, and the more confident they feel, the better they grow. So don't try to distract our children and get them away from us. Let's include them in our lives, and it can be something so small as, let's get our pajamas ready for bed, and they picking up their own pajamas from their own cupboard, closing the cupboard door, sense of accomplishment.
Absolutely, 100%. Yeah. Another cute thing that you can integrate into everyday routines is what we call absurdities.
Okay, fun.
And it's
I think
really
this is going to be up my alley.
Yeah, no, it's a lot of fun. So for example, it's breakfast time and you're getting a bowl of cereal ready. So you can pretend to pour the milk into the box and get your kid to say, no, don't do that, okay? And that is a whole language experience.
Well, that's what Tumbling Tigerz lives on. And we just love to play and make fun. So is it called absurdities?
Yes.
I love that.
Yeah, verbal absurdities. Or it's bath time and you can pretend to pick up your kid fully clothed and put them into the bath and go, Mommy, no, my clothes are going to get wet. And all of those, like just playing around and having fun and introducing humour into your interactions is a great way to learn language as well.
100%. I've been including humour with my children for so long, they don't even find me funny anymore. So yeah, I need to give them a pause so they can realise that I'm actually hilarious.
Wait until they're teenagers.
Oh, there's a
then their breathing will your breathing will irritate them. They may not even want in the same room. It's funny for as long as you can.
Okay, I'll keep doing it as long as I can. Okay, so this is a good question for me because obviously I'm one of the nervous moms in the world. What is the number one thing that parents should not stress about when it comes to speech? I know it's an odd question because I said not stress about, but the only reason why I say that is because I want to introduce this concept that our kids are okay. Yeah. You know, let's not look for every little thing that we can improve for them. Let's just find something that they really are struggling with and then work on it. But let's not over stress. Let's not over therapize our children, and let's just realize that they are still kids, you know, at the end of the day.
That's another great question. So I think, Shani, that we tend, when it comes to our kids, even if we're in a partnership with somebody, even if we're co-parenting with somebody, when parents stress about their kids, we take that stress on ourselves.
We do. We do.
And we forget that whatever that burden is or whatever that worry is, it doesn't have to be shouldered alone.
Okay, that's a nice thing.
And I think that teachers, therapists, friends, all of those people are helpful resources. Because, let's face it, there are some parents and caregivers who are dealing with children who have very significant communication difficulties for whatever reason. Maybe their child has cerebral palsy, maybe the child has Down syndrome, maybe their child has quite a severe learning difficulty. Everybody has their own path and their own journey. I think that the key to not worrying too much, because obviously we want to be concerned, we want to have a realistic idea of where our children are, where they are managing, and where there are gaps that could potentially derail them in terms of their happiness and their self-esteem and their confidence and their ability to manage. But it's not a journey that has to be taken alone. And I think that as long as you as the parent are going to reliable sources of information for help. So don't go onto some random like Facebook or Insta or TikTok group, unless it's like, you know, really verified.
I hear you.
Go to somebody that is trustworthy, who understands the questions that you're asking,
Yes.
who has real information to offer you, who can help you to put things into perspective. But don't go through that worry alone.
Yes.
You can share
Don't put that
concern
burden on yourself.
Yes.
And I do agree to that, because when you keep something bottled up, you have a very big tendency to exaggerate and dramatize whatever is happening to you. So if you're not alone and you're sharing your information, you can also have someone on your team who's saying, I think that's a little bit, you know, over dramatic. Don't maybe be so worried. And it can try maybe help your emotions, not escalate,
yes.
and rather be a little bit more calmer about it
yes.
as well.
And
Because
I think,
parents we're sensitive.
we are.
We're sensitive
We are.
little bunch.
And sometimes it's hard to put things in perspective, especially if it's an area that you don't know anything
Exactly.
about. You know, if somebody had to come to, like, when I get anxious about tax season, because I consider myself to be a relatively clever person, but don't talk to me about tax because then I feel like a nincompoop. So I have people who help me with that.
And it's finding the person that can help
exactly.
you.
Exactly.
Wonderful.
And if speech and language development is not something that you know a fortune about, that's okay. You don't have to. Find somebody who does.
And it's not your profession. You do something every day, 9 to 5. Find your professional.
Yes.
Basically.
Exactly.
I love that. That's very good advice. Very, very good advice. Okay, so I think I'm going to have 2 more questions if you don't mind.
Perfect.
Okay. I want to just, one myth that you could debunk about speech therapy, something that you hear constantly or people think that's got nothing to, you know, like something that you could get frustrated about.
So one of my favorites, the truth is it doesn't happen so much anymore,
Okay.
because I do think that we work better with our medical colleagues than we used to. But it used to happen quite a lot that a child wouldn't talk, and the pediatrician would say, don't worry, Einstein only spoke when he was 5. Children have to make noises.
Yes.
They have to meet their developmental milestones. They have to have all those pre-linguistic skills that we spoke about, even before they're 1. Maintaining eye contact, pointing at things, showing communicative intent. By the time they're 1, they should start saying their first words. By the time they're 2, they should start putting 2 words together. By the time they're 3, they should be putting pretty much like sentences together. And by the time they're 4, they should certainly have fully developed language. And so when a pediatrician says to a mom of a 2-year-old, you don't have to worry, that drives speech therapists insane, because there are things that we want to check, like we've spoken about, the importance of hearing tests for a child who may not be hearing properly, because there are things that are insidious that you might never ever know. Like children often have glue ear, or they've got fluid in their middle ear that they don't even realize is there, because they either have a high pain threshold or because they just get used to that feeling of being like underwater all the time, and that can have significant impacts on speech and language development. So if your child is not hitting their developmental milestones in terms of speech, it's not okay to wait until they're 5 because Einstein spoke when he was 5.
But for all these milestones, I will drop them in the link below so that you can read them again. You've mentioned a good set for each age group, which I think is so stunning for all of our listeners. So thank you for that. Information well received. Okay, and then this one's just a funny one.
Okay.
It's just to get a laugh. If speech therapy was an animal, what would it be?
Ooh. Okay, well, it would have to be an animal that was inclusive and that was very communicative and that was very noisy.
I'd say, if I'm going to get...
A chimpanzee.
A chimpanzee, I love that. I was going to say a peacock, actually. Because they make quite a fair amount of noise and they're very displayative, but I think a chimpanzee is the right one to say. Thank you so much for coming today. I really think that this information is going to be so useful to our parents, and they're going to be drinking this up, I promise. They're going to love it. Do you have any last things that you'd like to say?
Just that if you are a parent with a child and you have concerns or worries, pick up a phone. No speech therapist is going to bill you for a phone conversation where you say, this is what my child is doing, I'm worried about it, is it something I need to pursue or is it something I can leave? And just put your own mind at rest.
I love that.
So, yeah, you're welcome to
good closing.
Details.
Yes. And then
yes.
I'll also put Tully's details in the link below so you can contact her if you'd also like to. She's in the Johannesburg area. So anyone in France, sorry.
Your franchise is in France.
Yeah, my franchise is in France. I'll have to send you over there. I'll fly you.
I'll have to send my daughter. I don't speak French, but she does.
How many children do you have?
I have 3. My
Three
baby
children?
is 17. She's going into matric.
Your
next year.
baby
My
is 17,
baby is
but you say it like you
17.
have a baby. Splish splash.
Splish splash. We did all of that. We did that.
So you actually don't even look old. I'm not going to lie to you. You look
Oh,
very,
thanks.
very young.
I have a 17-year-old, a 20-year-old, and a 23-year-old.
Wow, that's so amazing. And I've only got 2 kids, so any advice for someone who's thinking of a third? You're like, don't do it.
No, I can't give you advice about that. I just know that when I had my daughter, I was so happy, and I just like so happy.
Every
to have my
single
daughter.
person has
But when
said,
my husband said to me, "It's time for a 4th," I was like, "I don't think so. I don't think so."
that's not happening.
Yeah, that's not happening.
Okay, very interesting. Yeah, well, every time I've spoken to someone, they're like, the third child just makes it, you know, like completes the family. That's all of the information that I've received on a third child. Everyone's just like, just do it.
No, you have to do what's right for your family.
You have to do what's right
and for you.
Exactly.
And for you.
I just don't like being pregnant.
Oh.
Yes, that's my only issue. But I love the child when it comes.
Do you have terrible
It's
pregnancies?
terrible.
Nauseous.
And
Yeah,
I don't
yes.
eat it the whole time. I have food aversions, chicken, beef, rice cakes, rice, anything. I just feel gnaw looking at all food.
You need a surrogate.
And yeah, that's actually not a bad idea. Call the people in France. But anyway, thank you very, very much for
Thanks,
coming
Jamie.
today. And if I need another interview, I'm calling you, hey?
Sure.
Awesome. Thank you so much for joining us today for our awesome interview. And stay tuned for our next episode where we'll have another therapist coming to chat. Who will it be? What will it be about? Stay tuned and you'll find out.
Bye.
Bye.